Hi, this is Julie Grimm, and I'm the founder of Ready for Recovery, a collaborative patient outreach program that benefits providers, patients, and caregivers. In 2005, I was diagnosed with a brain tumor, and in '08 with stage 3 breast cancer. So I've been through the treatment process, I've experienced the fear and confusion, and during that time, I recognized serious gaps in patient support. So the Cancer Treatment Planner is the tool that bridges those gaps. Our goal is to help you solve some of the common issues that centers are facing today, like efficiencies, communication with patients, compliance, referral rates, and overall improving the quality of cancer patient care. Information overload makes the process that much more confusing and complicated. So the planner is designed to make the process easy. It's designed to support patients every step of the way. It's easy to use, it's comprehensive, it's a roadmap of what to expect, how to prepare and organize. There are specific sections for tracking everything from initial diagnosis all the way through survivorship, questions to ask your doctors, terminologies, logs, and charts. There are tips for coping medically, physically, and emotionally, and ultimately a patient will have a completed history of their cancer journey. Let's start by reviewing the versions we have available. We have a breast-specific planner set, and we have one designed for any type of cancer. They come in 2-piece sets, which include a planner and a journal. The breast-specific set comes in our trademark green cover with a floral pattern and a matching floral journal. The multidisciplinary set comes in either the green or a brown cover with a spiral pattern and a matching spiral journal. They are designed to be taken to each and every appointment. That way you have all of your specific information relevant to your specific diagnosis at your fingertips at all times. And both versions come in either English or Spanish. The 3-ring binder is designed to organize the 8.5 by 11 paperwork, like test results, blood draws, things that don't necessarily need to go from appointment to appointment with a patient, but it's important paperwork. So organize it in the 3-ring binder and leave it at home so you don't have to carry this cumbersome notebook with you. You can either add the 3-ring binder to the 2-piece set to make a 3-piece set, or you can replace the journal with the 3-ring binder. We also offer a branded carrying bag that's a nice gift to help a patient keep everything together and with them from appointment to appointment. So why is the Cancer Treatment Planner so important, and how is it going to help your center solve some of your problems? Industry standards today are requiring centers to increase their performance. Research is showing that engaged patients help hospitals cut costs, improve outcomes, and increase referral rates. Therefore, a self-management tool to engage patients instills a sense of ownership and confidence, improving their comprehension and compliance. 50% of patients leave doctors' offices not knowing what they've been told. 80% of all serious medical errors involve this type of miscommunication. Adherence is directly related to a patient's level of understanding, making a tool to help patients retain and understand information essential. Non-adherence to medication causes 125 deaths annually, accounting for 10 to 25% of avoidable hospital admissions. Accuracy rates, on the other hand, increased from 55 to 72% when patients used a medication log. $150 billion are spent each year on missed appointments, 40% due to forgetfulness. Again, an organizational tool helps alleviate stress, reduce no-show rates, and increase compliance. Patient experience impacts a hospital's reputation, and a mere 5% increase in patient loyalty could generate more than $11 million. So, gifting a helpful tool builds relationship and trust, improving patient satisfaction, retention, and referral potential. So as you can see in this research, one of the most important factors is that in order to improve patient care and compliance, patients need more support than they're getting now. The Cancer Treatment Planner provides that support. So prepared patients are better equipped, more compliant, and easier to work with. This tool helps alleviate fear and confusion, It grounds, organizes, and supports, reinforces instructions, helps with retention, communication. It improves memory, there's inspirational support, and it's easy to hand off to a caregiver. Lisa Spencer with Penn State has been using our program for years, and she says we hear over and over again the planner was a godsend and has given patients a feeling of control. That control ultimately translates into a more confident and engaged patient. And we know engaged patients cut costs, improve outcomes, and increase referral rates. There are greater and greater demands on providers these days, and the Cancer Planner helps take some of that burden away by empowering and supporting patients to be more involved and accountable. The result is a more grounded and compliant patient who is less likely to relapse or need emergency visits and requires less hand-holding and time from their medical team. They will miss fewer appointments, and the chance of misadministering drugs will also decrease. The planner helps centers fulfill COC standards for accreditation as well as requirements for survivorship care plans. It streamlines coordination of care, communication between disciplines, and builds stronger relationships. It truly is a win-win for all. Mason General is just one of the many hospitals that has been using our program and has been thrilled with the product and the efficiencies that it has provided. Let's talk about customization. Our goal is to make it easy for you to make it your own. These are some examples of other hospitals that have branded their first tab card. We also offer black and white content pages for specific programs you may offer, resources you may want to recommend to your patients, any proprietary educational information you'd like to include. We also offer promotional cards if you're interested in recognizing a foundation or an event that's upcoming. There are many ways you can customize these planners. This slide explains our pricing structure. As you can see, we have a minimum quantity of 25. It also shows your customization options. And lastly, I wanted to share with you why I intentionally designed the Cancer Treatment Planner as a paper-based system versus an app or something online. Technology tends to be frustrating, causes a lot of anxiety and confusion. A paper-based system, on the other hand, is a whole lot easier to use. There's no technology to fight with, apps to download, or passwords to remember. The planner has made a huge difference in a patient's ability to handle the challenges of cancer treatment, in large part due to the support they feel from the tool and the engagement and control they gain using it. In turn, this has tremendous recourse for a cancer center's bottom line when taking into account the time and money saving potential. So please, if you feel Ready for Recovery is a good fit for you, please call us or email us anytime. And thank you for all that you do in service to cancer patients. We appreciate every minute of it.